few years ago, I asked some children to identify their favorite coach and explain why that coach was their favorite. And one 7-year-old girl described a coach who gave her frozen apple juice to ice her injured ankle and let her drink the slushy apple juice after she was done. Now, you may not be as creative with the way that you care for injuries, but that's part of your job as a coach. To be a complete coach, someone needs to teach, train, manage, mentor, and recruit people. And caring for injuries and preparing for injuries and preventing injuries are part of training. The circle of care, which was adopted by the United States Soccer Federation, provides a good big picture look at the roles that coaches can play in the prevention, preparation for, and treatment of injuries. So what do coaches need to do to prepare for injuries? Well, first, ideally they would have a first aid and CPR certification, and they would have a well-equipped medical kit, which would include plastic bags, scissors, sterile pads, gauze pads, first aid cream, ice packs, band-aids, antiseptic, ACE wraps, gloves, and perhaps most importantly, a team safety and information card, which would include pertinent information about each athlete. And for children, this would include contact information for their parents, maybe mom and dad's cell phone numbers, their work numbers, and the phone number for their pediatrician. So what can coaches do to prevent injuries in the weeks or months before competition begins? In each sport, there are certain injuries that are common. For example, ACL injuries are fairly common in basketball and soccer. So a coach might have their players do something like the star drill, where they stand on one leg and touch spots around that leg with the toe on their opposite foot to build up the stabilizer muscles in their knee. Next, coaches can help prevent injuries by leading their athletes through a proper pre-training and pre-competition warm-up that involves sport-specific movements that progress from low intensity to higher intensity. And the warm-up should be dynamic rather than static. When I was growing up, it didn't matter whether I was at baseball, basketball, football, soccer, hockey, track, wrestling, or tennis practice. Practice began the same. We would stand in a circle and engage in a series of static stretches, right over left, left over right, and so on. But this is incorrect. It turns out that static stretching before a training or competition actually decreases performance and slightly increases the risk of injury rather than decreases the risk of injury. So static stretching isn't a bad thing, but it is not a good thing before a training or a competition. Pre-training or pre-competition warm-ups should be dynamic warm-ups. And after a competition or a training, the warm down should start with dynamic movements as well, which are sport specific and progress from more intense to less intense. Coaches can also help their players reduce the risk of injuries through proper hydration, using an electrolyte glucose solution like Gatorade rather than just water, because an electrolyte glucose solution gives the player back everything they have lost during a training or competition: water, salt, and sugar. Now, you may be lucky enough to have a team of experts to call upon if someone gets hurt, but you need to be literate in injury care so that you can make decisions about when professional help is needed. Some injuries are relatively minor, like a quadricep or hamstring pull, which may require a couple weeks of rest until the athlete is 90 to 100% functional, along with ice, stretching, and some movement to get ready to come back. Ankle sprains may be a little bit more serious, requiring 2 to 4 weeks of rest until the athlete is 90 to 100% functional, with rest and ice and compression to treat the injury. until the athlete regains a full range of motion. The treatment for a knee sprain may be similar, but more ice may be needed to bring down the swelling. But head injuries and heat illness can be much more serious. The proper treatment of heat illness depends on the severity of the illness. A less severe form of heat illness is heat cramps, which involves muscle tightness and requires shade and fluids. Heat exhaustion is more serious and involves fatigue, headache, and clammy hands, and requires shade, fluid, and bathing in cool but not cold water. And heat stroke is even more serious and is a medical emergency. An athlete suffering from heat stroke would have a temperature in excess of 104 degrees Fahrenheit and might be vomiting. And this is certainly not something that a coach would want to try and treat or deal with on their own, and certainly wouldn't want to do something as sadistic as withhold water or medical treatment. Our focus on head injuries and concussions has increased dramatically over the last decade. But symptoms of concussions involve headache, blurred vision, vomiting, memory loss, dizziness, poor balance, sleep disturbances, drowsiness, fatigue, poor concentration, ringing in the ears, sensitivity to light, irritability, and sadness or depression. Treatment protocols for head injuries have evolved with the increased focus on concussions over the last decade. In the NFL, for example, there's a trainer who sits up in the press box and looks down, scanning for players who might have sustained a head injury and communicating with healthcare officials on the sidelines. And during preseason, each player is subjected to cognitive tests which would provide a baseline to compare against if a player is suspected of a concussion during training or competition. Now, not all programs have the resources to follow the NFL protocol, but it's important that coaches proceed with caution in dealing with head injuries and they educate themselves about concussions. So for the sake of your team and for the sake of the people under your care, take the time to prepare, to prevent and treat injuries, and to make decisions about when professional help is required.